All right, good morning, everyone. Thank you for joining the fall IAPOH meeting, Follow into a Fresh Approach to Nutrition, Physical Activity, and Chronic Disease Prevention. My name is Jana Simon. I'm with the Illinois Public Health Institute. We are so excited to have you with us today for this meeting, and we really look forward to talking about what's new for the Illinois Alliance to Promote Opportunities for Health. So thank you. You can go to the next slide, Sarah. So first, what we want to do today is welcome you all. We want to really spend a lot of time today revealing to you the a year and a half of strategic planning and some work to restructure this coalition to work better for you and the way you want to participate. And so we're really excited to welcome you to today's meeting. We do have some housekeeping that we want to take care of in the next slide. We would like to encourage you to type questions into the chat box throughout the day today. We will be recording today's meeting. It's being recorded. We will also be recording a portion of the breakout rooms later just to capture the presentation portion of those. Closed captioning is available for anyone who needs it. We've turned it on. And if you have any issues, you can chat Sarah Flores on our team with any issues on the side, and she can try to help you with those. And we will be providing these slides after today. So we'll send a follow-up email for anyone who is interested in looking at these again. And for many of you, if you had registered before noon yesterday, we did send out materials in advance of the meeting, and those will be recent for anyone who's registered after noon. So again, thank you for joining, and you can go to the next slide. So here at IPHI, we like to start our meetings with some group norms just to make sure we're all on the same page about how we want to interact with each other. So we'll share those with you today. We also use these, some of these in our work around diversity, equity, and inclusion. And so we wanted to share those. So as always, if we are talking later in the breakout groups and speaking, we ask one person to speak at a time. We encourage you to take space and make space, which is really about speaking up, but also standing back if you do talk a lot to let others have space to speak. We know no one knows everything, but together we know a lot. And this is all about IAPOH. It's about the collective and what we can do together. We encourage you to engage authentically and with respect today. All ideas are welcome and encouraged. We want to create a non-judgmental space for people to share or not share their perspectives, and it's up to you all to decide. We hope to assume good intent for people's conversation and behavior, but also to acknowledge and take responsibility if there's any harm, regardless of your intent. And please allow us as facilitators to move us along as needed, as we have a lot to pack in. Are there any other group norms? You can go ahead and put those in the chat for us to consider. But we do hope this will be a fun and engaging meeting for you all to learn about what the next phase of IAPOH is. See none in the chat, so I will go ahead and continue. So what we'd like to first do is start with introductions. We have a growing number of you on the call, and we expect many more to join us this morning. So if you could, please start by putting your name and your organization in the chat box. And what are you most excited about for today's meeting? So if you want to go ahead and do that in the chat box, and the IPHI team can do that as well. And we have several of us from IPHI here today to help facilitate the breakout sessions. So you can keep an eye out for who those folks are in the chat. I'll give you a moment to do that. Great, welcome Matt, welcome Rick, Laura, Anna, Allison, great. So connecting with, making connections with your work, excited to learn about new ongoing initiatives, new work, excited to learn about the coalition, learning more about the group, awesome. So a lot of people here to learn more about how to get engaged and to connect to your work. That's exactly what we want, so we really appreciate it. Thanks, Ro, these are coming in so fast. New approach. Awesome. Great. Yep, for anyone who's just joining, we're just doing introductions in the chat about your name, your organization, what you're most excited about for today's meeting. The future of our focus and approach. Awesome. Fresh start, yeah. Getting connected to subject matter experts, seeing how our next grants help support this work. Awesome. Okay. Well, with that, I think we can move on to the next slide. So what I want to do is give a little bit of background just to ground us in how we got to today's meeting. Just a really short update. And for many of you, you've been part of this process for the last year and a half. And for some of you, today might be your first meeting. So we want to welcome you and give you the context you need. I will just do a little shout out and you'll see it later. Our new logo for the Illinois Alliance to Promote Opportunities for Health is at the top. So we're excited to have that. And thanks to the leadership committee who gave feedback on the iterations of this. So if you want to go to the next slide. So the Illinois Alliance to Promote Opportunities for Health started as the Illinois Alliance to Prevent Obesity in 2010. And this was our bringing together of folks across the state to ask if we needed to have a common approach to obesity prevention in the state. And the answer at that time was overwhelmingly yes. So it was over 12 years ago that we brought partners together to have this shared sort of policy and systems change lens to obesity prevention. We worked off of an obesity action roadmap that was developed through some statewide regional convenings, a scan of evidence-based best practices, and bringing together of many, many people and organizations across the state. And when that roadmap first came out, we had over 140 organizations officially sign on and endorse that roadmap as something you agreed to participate in. We also have been led by various committees, including a leadership committee. We've had topic-specific working groups. And all of these groups have helped drive the policy, systems, and environmental change agenda for the coalition. And we've had many, many of you over the years bringing ideas to the table, leading campaigns, sharing communications, sharing policy expertise, and really coming together. And as you know, the Illinois Public Health Institute has been the backbone organization for the coalition, providing support to help convene partners, sharing communications and actions from each other with the rest of the group, creating listservs and things like that. And in more recent years, we've helped sort of bring in and share federal and state dollars back out to Illinois communities to continue the work that the coalition has been doing. So that's sort of who we are in our history. And it's been about 12 plus years now. And we are ready to move into the next phase. Next slide. So strategic planning, in the summer of 2022, we decided it was time to do another round of strategic planning. This was about a year left in some of the 5-year cooperative agreement grants IPHI had that was supporting IAPOH's work. We also had just been through a global pandemic. Lots of things have changed, an increased emphasis on diversity, equity, inclusion, and anti-racism, especially after the murder of George Floyd. And we really decided it was time. It had been 5 or so years since the last strategic plan of this coalition. So we started with the activities you would typically do of looking at an assessment, bringing folks together, looking at strengths and weaknesses and opportunities. And we convened many, many meetings with you all to update our mission and vision for this coalition. And we hosted several topic-specific meetings to set goals and create strategy for those goals. All of the input gathering process, we were able to update the coalition strategic framework, which you should have found in your materials we sent to you in advance. Also, if anyone from my team can throw that URL in the chat of where to find our strategic framework, that would be great. And this framework was shared out at a coalition meeting in the spring. We did know, though, that we needed to also restructure the way we operate. So part of the strategic planning, we did some assessment of our coalition membership and structure, and it was resolved that we needed to launch some intentional efforts to broaden our membership and to better reflect the diversity of the state, and to restructure so that we ensure our community voices are driving the coalition's work and decision making. So we finalized the strategic framework. If you go to the next slide, we've learned that through our restructuring, our goals were really to center community voice and make sure we're listening to what Illinois needs and wants in chronic disease prevention, nutrition, physical activity. We want to ensure meaningful power sharing at the leadership level of the coalition and ensure that a combination of subject matter experts and grassroots leaders are coming together to create a coalition that works for us all. We, of course, want to reflect the diversity of the state in our membership, both by region and geography, race and ethnicity, income, gender, etc. And we want to facilitate bridging of sectors that promote health and prevent chronic disease. Next slide. So our restructuring timeline, this is sort of the beginning of the new structure. So today is the rollout of the new framework, brand, structure, and engagement of all of you as core partners or ongoing partners who have been with us through various pieces of this. And the goal is that in 2024 is when we will really launch this new structure. So we're hoping to roll out our new working groups. We'll have an in-person meeting in the spring of 2024, where we'll really bring in a lot of new partners and launch this sort of coalition-wide meeting in the spring. But we'll be inviting you all, and we'll actually have a calendar of events and all of the sort of work group things ready ahead of 2024, so you can see exactly what we're offering and how to engage. And we'll be doing some, of course, engagement of all of you to reconfirm and recommit to the coalition, and also at some intensive new partnership development work leading up to 2024. Go to the next slide. Just a little bit more about who we engaged. We had IAPOH member surveys that went out to our whole listserv. We had several strategic planning meetings. I think we had 8 or so, and some topic-specific meetings. We also in recent months had discovery meetings around the structure specifically, and you can see the group of partners. We had some community-based organizations, local health departments, some past partners who have been with us, but we've sort of lost touch, and then some folks specifically in Southern Illinois, knowing that it's a group that is not always as represented in our work. And then we also did some key informant interviews with some of you who we think are doing really great coalition work and engaging communities really well, to learn more about how that was being done. So all of this has led us to our new structure. And I think at this point, I'm going to pass it over, if you want to go to the next slide, to unveil our new name, mission, and vision. I'm going to pass it to my colleague, Sweet Pea, who can tell you more about our new name and such before we move on to the structure piece. So Sweet Pea, take it away.
Good morning, friends. Thank you so much for being here today. We are so excited to unveil some new things about IAPOH. And do we have a slide for our mission and vision? Oh, here we go. Okay, so our new name, of course, is the Illinois Alliance to Promote Opportunities for Health. So we are still IAPOH. We just have a little H at the end. So hopefully that's not too hard to too much of an adjustment for folks. Along with our updated name, we also wanted to update our mission and our vision for this group, which we will have on the next slide. Okay, so our new updated vision statement, if I can get all my little Zoom boxes out of the way here, is that our updated vision statement is that we are an Illinois, and that we are, our vision for IAPOH is an Illinois in which our collective efforts, representative of our diversity and all cultures, lead to policies, systems, and practices that enable all residents and communities equitable access to nourishing food, opportunities to engage in safe and enjoyable physical activity, and are supported to maintain their health and well-being. And our updated mission statement is that the Illinois Alliance to Promote Opportunities for Health is a multi-sector coalition that integrates community voice to develop, change, and implement policies and systems to support access to nourishing foods, safe and accessible physical activity, and eliminate social and institutional barriers to achieving optimal health. Foster communities and institutions to integrate nourishing food and physical activity for all, and to bridge partners and sectors across the state to coordinate approaches to chronic disease prevention and the social and structural barriers to nutrition and physical activity. As we move on, if we want to go back to that last slide for just a second, and I would love for folks to add in the chat, and we'll do a chat waterfall to say what about our new mission really resonates with the work that you do at your organization. So just to pick one out for an example, one of the things that I love about this new mission is the ability to foster communities all across Illinois. I am a Southern Illinoisan and am really excited to have the opportunity to really promote cooperation and information sharing all across the state with our friends up north. So if you want to just take a few minutes, we can pause for a few seconds here and let folks go ahead and do that. Oh, and there's already some really exciting things I see in the chat. Laura says that safe and enjoyable physical activity, preferably outside. Catherine offers up that optimal health really reaches out. Melanie says equitable access. So go ahead and continue to drop those in the chat. Yes, let's see, what else do we have? To support access for nourishing foods is also another piece. Let's see, folks are interested in the bridging partners and sectors. Nourishing foods and contributing to nutrition security and not just food security. That's really exciting for me because I am new to IPHI and to the food justice world, and that's a difference that I haven't really thought about or heard of. So I'm super excited to learn more, Bree. Breaking down barriers within schools that keep students from attaining optimal health. And again, bridging partners and sectors together for increased access to food and physical activity. Apologies if you hear my puppy in the background. He thinks I'm talking to him and not you all. Okay, so go ahead and you can keep on dropping those in the chat as we start to move forward.
Great, we can go to the next slide. And one more. And I'm Sarah Flores here and going to take us to our next part about our updated strategic framework and overview. So as a coalition, we understand that in order to achieve optimal health, we must impact local and state level policy, increase capacity for community-based organizations, and bridge communities working together to address nutrition and physical activity. So as part of that, in updating our strategic framework, we developed 8 topic areas that we'll address within our 5 working groups and leadership and equity committee. Next slide, please. We'll talk more about the work groups and the leadership and equity committee soon, but our topic areas that were selected for focus include food systems and nutrition policy, chest and breastfeeding support and equity, physical activity in the built environment, early care and education, school health, diabetes prevention, social connectedness, and social determinants of health and bridging sectors. Next slide, please. And so of these, 18 goals were identified to go along with each of our topic areas. So some examples of those goals for food systems and nutrition policy, it would be building local food systems to support Illinois farmers, food producers, and businesses to meet our nourishing food needs. In the chest and breastfeeding support and equity topic area, it'd be improving the continuity of care and support for chest and breastfeeding in Illinois communities. And in the social connectedness topic area, increasing those opportunities to promote social interaction through public health and aging partnerships. So for each of the goals, we also identified strategies. Strategies include policy change, capacity building, and bridging sectors, connecting partner strategies. So you can find more details on all of this in each topic in the PDF link there, and we'll chat that as well. I'll now pass it along to my colleague, Martha Margaret Cotton, to talk more about our new structure and ways to engage.
Thank you, Sarah. Good morning, all. I am Martha Margaret Cotton, a program manager here at IPHI. So now we're just going to kind of get into talking about some of the new structure we referenced previously and some different ways that you all can get engaged. Next slide. So throughout this year and a half, we've heard from you and learned ways to best engage you. So here's kind of what we gathered. IAPOH should lift up community leadership to ensure those most impacted by disparities in chronic disease prevention have an opportunity to lead the policy and systems change work. Partners and communities being impacted by policy work should be a part of the planning and implementation from the beginning. The work groups should be co-led by people who work in their communities, regions every day and understand the grassroots context, and by people with policy subject matter expertise and/or statewide or regional approach to the work. Most meetings should happen on a quarterly cadence to ensure that we don't overwhelm our partners with too many meetings. We should rotate the days of the week and times of the days meetings are held to help ensure that all who want to join can at some point throughout the year. We should also improve communications about upcoming meeting dates and times and ensure a broad audience has access to these meetings. And we also heard about ways of improving accessibility, which you can see on the screen. So all of that led us to our new structure, and we invite you to join us as a leader of the coalition or a general member. Next slide, please. So we invite you to join the Leadership and Equity Committee by becoming a work group co-chair or volunteering as an at-large member of the committee to provide guidance on IAPOH's strategic direction to accomplish our mission. The Leadership and Equity Committee provides input on policy priorities, strategies, and funding our engagement opportunities, and provides guidance to the Illinois Public Health Institute staff to keep equity at the core of IAPOH operations and coordination. The committee is restructuring to better reflect the diversity of the state. The goal is to ensure community priorities are driving IAPOH's PSC agenda. Will be composed of work group co-chairs, more on that in a minute, and at-large members. We'll be looking for a mix of members that represent different regions of the state and urban, suburban, and rural areas, different priority communities, different topical areas of expertise, etc. So we'll ask for a 2-year commitment with members signing up again this fall or winter to commit themselves as leaders. If there are more volunteers than open positions, we'll ask work groups and the coalition to vote on membership. Community grassroots leaders who participate outside of their regular employment will be compensated for their participation. So please join the Leadership and Equity Committee information session during the breakouts to learn more. Next slide. So co-chairing a work group is also a great way to become a leader within the coalition. IAPOH will convene 5 topic-specific work groups and 1 communications work group to help put the IAPOH framework priorities into action. And you can see them on the screen as Sarah had previously discussed. So each work group will be co-led by a grassroots community leader and a policy or subject matter expert in that topic area. It will meet quarterly with IPH staff available to support. Work group co-chairs also serve on leadership and equity committees. The work group may work on specific legislative and advocacy campaigns and/or generally work to implement the IAPOH strategic framework priorities. Co-chairs are responsible for working with IPHI staff to set the meeting agenda, drive work group strategy related to the IAPOH framework implementation, and support facilitation of the group. Next slide. So we invite you to join IAPOH as a general member as well. And this would give you access to joining one of the IAPOH's 6 work groups that we just discussed. Work group members are responsible for providing insight and support to implementing the framework priority strategies related to the work group and may contribute their own organization's expertise to the group, which is optional. Quarterly learning and peer networking webinars on topics related to IAPOH's mission would be included, a monthly IAPOH newsletter with policy updates, community engagement opportunities, resources, and more. The IAPOH listserv to communicate with others working on similar initiatives across the state. Topic-specific listservs for breast and chest feeding support and physical activity built environment are also available. annual coalition meetings to network and weigh in on policy and systems change priorities, and access to training opportunities such as Policy 101, grassroots advocacy, and meeting facilitation best practices. And now I will turn it over to my colleague, Catherine.
Thanks, Martha Margaret. Good morning, everyone. Really exciting to see you all here. I'm Catherine Bernstein, she, her, a senior program manager here at the Illinois Public Health Institute. So what you're seeing on the screen now is a bird's eye view of how this new structure will be rolled out over the coming months. All of our partners, including all of you here today, will have a chance to formally join IAPOH and endorse our mission and our framework that we've developed together. And I'll talk a little bit more about that endorsement process shortly. As Martha Margaret mentioned, we'll host any elections for leadership positions that do have more interest than space in January of next year. And with all of those elements in place, the official launch of the new IAPOH will take place in 2024, with the current leadership committee finishing its term at the end of this year. And throughout all of this, we hope that you as IAPOH partners and us will continue relationship building and engaging new partners and voices to join us. So this is a little bit about more of the first step in our rollout process, which is the endorsement form. Completing this form is how you and any organizations you're affiliated with will officially become members of IAPOH and endorse our framework. The form will also give you a chance to select how you'd like to get involved, whether you'd just like to receive newsletters and updates, or if you're able to engage in a leadership capacity. We'll also be able to use this form to learn a bit more about your organization, so we'll have a better sense of our collective assets as a coalition. We'll ask for everyone from your organization that wants to be involved in IAPOH to complete a form so that you can indicate how you would like to engage. But we'll just need one person from your organization to officially sign your organization up as an IAPOH member. And I think the link is in the chat, and it was sent out with all the meeting materials too, and will come throughout the months to come, I'm sure. So feel free to go ahead and start signing up, and you'll notice there's a question in there that'll allow you to indicate if you're signing up on your own or for your organization. And we are asking all partners, old and new, to sign up again. So even if you've been an IAPOH member for the past 12 or more years, please go ahead and fill out the form. So that's how the overall IAPOH structure and rollout is going to work. And now we'll be digging in a bit more to learn about our 6 work groups and start the very initial process of planning for their priorities. So on the next slide, there are the 6 working groups that have been mentioned that IAPOH will have. And underneath each of the work groups names on this slide are some of the grant-related strategies and specific campaigns that will live within that work group. So for the food systems and nutrition policy work group, that group's going to house the nutrition policies in our IAPOH framework. It's also where this state physical activity and nutrition, or SPAN program, food service guidelines, and other nutrition strategies will live. This group will hear updates on the USDA Innovation Hub grant, and it's where a lot of the work for the Healthy School Meals for All campaign will take place. In the physical activity policy and environments work group, that's where the physical activity strategies from the framework will be built out and implemented. It's where the SPAN, again, the State Physical Activity and Nutrition Program physical activity strategies will live. It's where the Illinois Department of Public Health physical activity equity strategies will take place as well. In our healthy lifestyle programs and systems work group, that's where the diabetes prevention framework strategies will take place. the CDC 2320 strategies that apply regional and statewide work around healthy family weight planning will happen there. The Medicaid beneficiary enrollment project work for the National Diabetes Prevention Program will go on there. And of course, it's open to other lifestyle program work as well, like heart health and so forth. In the childhood health work group, that's where the school health and early care and education framework strategies will live, as well as the state physical activity and nutrition program, early care and education strategy, and school health policy work of IAPOH. The chest and breastfeeding support and equity work group is going to build out the breast and chest feeding IAPOH framework strategies, the state physical activity and nutrition program breastfeeding strategies, as well as the Title V breastfeeding strategies. So if you are involved in any of that work with us, just wanted to share a little bit about where that will fall moving forward. We're also excited to have a new communications collaborative work group to strategically align and plan for IAPOH's communications activities. And finally, of note, although not technically a work group, the Leadership and Equity Committee will consider emerging topics, social determinants of health connections, and social connectedness, as those are more exploratory to us in nature. So we are now shortly going to go into breakouts, into these groups to learn more about and start to plan for whichever work groups you might be interested in. You will have the opportunity to join 2 groups. So go ahead and start thinking about which 2 groups you're most interested in. Again, your options are going to be to learn more about the Leadership and Equity Committee. That'll be more of an information session. And then each of the work groups. So food systems and nutrition policy, physical activity policy and environments, breast and chest feeding support and equity, childhood health, including early care and school nutrition and physical activity, healthy lifestyle programs and systems, or Fresh Talks, the IAPOH communications collaborations work group. So each round of breakouts will last for 25 minutes, and we will have a short break between them. Once we open the groups, you'll see the option to join a group at the bottom of your screen. You'll be able to click on that and then just select whichever group you're most interested in joining first. And remember, you will have the option to join 2 groups. So if we're ready, I think we could go ahead and open those. You should see a little pop-up at the bottom of your screen that says join a breakout group. Go ahead and click on that and then select the group you'd like to join first. Hope everyone has a great conversation. We're almost there. All right. I think what's next is we're going to actually be taking a 5